Okay, so we are now recording. And I'm going to make this a little bit smaller. And before we get started, I do just want to acknowledge and welcome Bill. He is the new manager director of the assisted living at Humboldt. And then do we have anybody else new on the line? Okay. All right. So we'll go ahead and get started. As always, why is this not moving forward? My PowerPoint is not moving forward, so hold on here. What is going on? Sorry, a little technical difficulty here. Let's move this back. See if we can, there we go. All right, so if we could all just kind of be silent for a moment, and then if you so choose, please read with me. Dear Father, we thank you for everyone gathered here now. Thank you that you know each of us by name and have caused us to walk with you. We say that we are dependent on you and our trust is in you completely. As we surrender ourselves in adoration, we ask that you would come by your Holy Spirit and inspire our hearts today. Come fill our lives with your love, fill our conversations with your grace and truth, fill this meeting with your presence. We ask this for your glory and praise. Amen. So today, this is the agenda for today. We did just come off of ULT, and some of you folks attend that as well. So you will see some of the information kind of similar or the same, but I think we're going to do it with a little bit more detail, particularly around the advanced care planning and what is expected and how we're going to roll out. So, and again, some of the, just a little bit different lens, because I know like the finances and such, Kevin just reported on. So we're going to go over current goals as we do, kind of our dashboard and how things are going, update on pricing in the electronic health record, update on the process of getting some admission resources and advanced care planning as part of that, supplies, and then some tools that have been added to eSource and are available for you all, and then just some general operational updates. So that's the plan. You know, if you can, just so that people can hear, if you can keep yourself on mute. Well, hold on, something just moved. I am really sorry. Normally I don't have technical difficulties. I am today. I need to get something up. Okay. There we go. And then some operational updates. So going ahead with the goals, as we did, we always review kind of where we're at financially, where we're at with the dashboards and things like that. And so this is, Kevin kind of updated in general, but these are specific to housing with services. And so our goal that we've been given in this calendar year is, or fiscal year, is 24% EBITDA. That's basically our net cash flow without the interest and depreciation, or our net operating margin. And we are currently at 20.5%. So we're still off that mark, a little low of what we're supposed to be. Our occupancy is at 92. The goal is 92, which is good, but the budget is actually 94 and going up to 95. So we're still a little bit low of what we should be, even though we are right at the goal. Our free cash is, have some ground to make up there. Our goal is 8%, and we are at 3.9. And our net operating income, our current month, we are at $2,042. At year to date, we're at a loss of $156,000 and some odd change. So I'm going to go into that in a little bit of detail. I know some of you folks also run the nursing home, so kudos to you. The nursing homes did really good this month. They actually made more money than housing, which is very unusual. But I think, again, it just shows that a lot of the steps that the care centers have done in order to see that improvement, we're going to be asked to do the same thing in housing, and we'll talk about that a little bit more. So this is a breakdown of the 4 groups that BHS kind of sets things up, group 3 being those new startups that we really expect to lose money. But what I think is important about this, and again, I want this to be a really positive call, but a very honest call, is that in every single group, we're not really making the mark that we need to be. And again, we've got Jerry Carley, and he really expects us to hold the budget. And so If you are one that's struggling a little bit, please expect to hear from me so that I can support you and pull teams in as appropriate, so that we can kind of get things back on track. Because if you look at every single one of our groups, you can see that we are off of budget, and off of budget total by over $1 million. And so looking at group 3 and the startups that are supposed to lose money, they're only a portion of that. We can't really just say that the budget is really due to those. So that's something that I think that we need to be aware of and mindful and kind of target in how we're going to turn things around. I know all of you are already acutely aware of this and working on it, but again, if I will probably reach out to you just to make sure that we're giving you the support and the tools you need in order to be successful. Any questions on that? Okay. We'll go to the dashboard. And now we're going to have to go to normally all of these things are up when I start these calls, but for some reason today it's not letting me do that. So apologize for that. And it's not letting me move this either. Huh? Where is it? There we go. I am really sorry, guys. Definite technical difficulties here. So we're getting a beeping from somebody. Can you all still hear me? I'm going to go ahead and put you all on mute. See if we can stop that noise. Can you all hear me?
Yep, I can hear you, Penny.
Okay.
Yeah, I can hear you.
Yep, I can hear you.
Not sure how to, it's not letting me mute people. That noise. Let's try it again. Okay. All right, so on the dashboard, you can see assisted living, resident to recommend. We're a little red on that. We're kind of yellow on some of the other areas of employee commitment index, new associate 90-day retention, associate retention 12 months, open position, we're looking pretty good, green there. Foundation contributions, a little below mark. Bad debt, we're below mark on that. And free cash flow, this is the system. So again, that other number, the housing is doing a little bit better than that, but we're not quite where we need to be on that as well. Any questions on that? Okay. Okay, I know you can't see what I can see, but I have two different things on my screen all at the same time. And one of them is not moving. There we go, not moving over. Okay, so this is the other thing that I think is interesting, and one that I kind of wanted to call out as we think about where these next steps are. This is our trend since 1/1/2017. And you can really see, even though you'd think summer is kind of move-in month, that that would be where our occupancy is the highest. But if you look back last year at June, it dropped too. So that's an unusual thing. But then it continued to climb up. And that also might have been with the opening of St. Gabe's that kind of skewed the overall census trend. But we were in a nice climb over the winter months. And so even when you think that's the time that the census would go down, the census actually went up at that time. So I think that that's a really good thing, but we are definitely seeing a dip right here. And we just got the most recent, it literally came right before this call started, the most recent census, and it dropped even a little bit more. So that's something that definitely, as we look at our financials, we really want to look at our occupancy and what can we do to support you in making sure that we're getting that going. There's some, especially folks that are attached to SNFs, there's some really cool cross collaboration that I think can help in that occupancy. and some other things that I know Jackie and Dina have that we can make sure that we're helping you to be successful there. So that's one area that I would definitely take a look at. The pricing update, just want to let you know that the Marion pilot is complete. We had a kind of a lot of back and forth on how things worked at Marion in comparison to Eldermark, and did our tools work, and was everything all set? And so I really just want to call out Marion and thank Noelle and Kay and Deb and all the folks over there who really helped us work this through. It was a lot of work, but I think we came up with a really good pilot end product. Linda Johnson helping to make that happen, and so now we're really ready to go to the next step. So we're moving on to Humboldt and Steeple Point, and then continuing to move forward. So especially we're going to start with Minnesota and then move to the other states. So if you're in Minnesota over the next couple of months, just expect that we will start working with you and rolling out that pricing structure. So we've got that. And if we have time in the end, I'll show you the tools. We've got a lot to cover today, so I just want to make sure that I'm watching the time, but we can go over those. I know I went over that on the last call in more detail. So again, we've got the pricing tool sheet, the pricing sheets, we've got all the templates, we've got the communication templates, thanks to Janice, and everything really ready to go. So this should be pretty easy and smooth. When we do come to your facility, what we are typically doing is we'll adapt it to your building and your community and the pricing in your community. So as a heads up, you're going to want your competitor analysis up to date. And then we'll usually roll it in over the 90 days as people are getting their assessments done and updated in their service plans. We can look at how do they fit into the new packaging. So that's kind of the process. And as a heads up, as I said, if you can update your market assessment so that when we come in, we kind of know what your competitors are charging, and we make sure that we're falling in line with that. Any questions on that? Someone's got their hands up. Okay. Okay, the electronic health record. We are still waiting for the contract. I know last time I said we were moving forward. We did meet with Matrix, and we had some good where they laid out what it's going to take and how long it's going to take, but they were unwilling to start starting the planning process until the contract is signed. Bill Krantz has got his pen ready. He does say that he expects it this week, no later. We did talk to Matrix and say, you know, this is taking way too long. We really need you to start working with us and getting those implementation plans set. So they actually have agreed to do that. Linda is on a call with Matrix while we're on this call right now, and then there's another one coming up on Friday. So I do expect to finally see that dam start breaking and moving things forward on that. They do have a new upgrade that's planned for September, and so the rollout would be easier after that. So we'll be designing things over the summer. Look for emails from Linda as request for input is put in, and then would be rolling out in October at the very latest, hopefully even sooner. With Steeple Point being small and independent, kind of easy to be nimble. Thank Crystal and Melissa for agreeing to be the pilot there, and so we'll work out the kinks there and then expand to the rest of you as quickly as possible. And again, Mike, it keeps freezing up on me. See if I can get it to move forward. Now my whole computer is frozen. There we go. Okay. All right. So this is something they went over at ULT, and Jana is on the call, and I'm going to have her cover because I want to just get a little bit more specific around her addressing any questions you guys have and what's going to be coming out to you in an email. So Jana has been spearheading in partnership with Trent, a group that's really helping us to come up with some consistent admission packages. So you can add things that are unique to your facility, such as your calendars and whatever, but that you'd all have the most recent handbook, the most recent lease, the most recent what have you, that would comply with your law. For example, North Dakota, I know Trent sent something out earlier in the year to you all, and Minnesota, the lease has been updated, and having the pricing tools in there and everything in there just easy and ready to go. Very similar to what the SNFs had, where it's all on Adobe, it's all logoed to your building. She's been working really hard on that. So most of what's in there relates to the pricing and relates to the lease. And so because we're moving the pricing out one building at a time, we will incorporate that admission package as you bring up your pricing structure. But in order to do that right and to do that one-on-one individually with you guys, we'd be a little behind the time of Dr. Neal's request for getting the advanced care planning up and running. So we're going to go ahead and roll out the advanced care planning, and after this call, you're going to be sent information for your state that should be incorporated into your admission package, and then you should start following this process as we go through. So, Jana, are you on the call?
I am on the call. Thanks, Penny. For some reason, now I can't make this bigger, and I can barely read it on my screen. Oh, thank you, thank you, thank you. Okay, so I'm Jana Kovac, and I'm the social service specialist with BHS, part of Clinical Services Group, and like Penny said, we've been working on this project, and some of you at communities, I had asked for your move-in packets just to kind of look at what everybody was using, and then a task force of Penny, myself, Linda Johnson, Trent Pepper, and Tricia Bergine took a look at all the documents, and with the help of Nancy at the Shoreview office, are putting them together so that they will be easy, just one click to print from eSource. So this is the algorithm that was created for the client move-in process for housing. Some of your communities have already been through the advanced care planning, the Honoring Choices advanced care planning, and have rolled out the process with facilitators, starting in the skilled nursing and then moving into housing. Others of you have not gone through it yet. We've had 4 cohorts, and there's 2 or 3 to go, which will be getting done here for sure within the next year, if not less. So I'm not going to totally read through this because I know that you guys have seen it at ULT, hopefully, or you can read through it. But, you know, in the move-in assessment, you would ask if they have an advanced directive or if they have a PULSE, and we do have the state-specific PULSE. Just to be clear again, the ADSMO that BHS was using for a while, the Advanced Directive Summary and Medical Orders, that has been sunset and it is gone. So we are now using the PULSE form through all levels of care. And if they say no, that they don't, you would ask if they would want CPR. This is kind of when you don't have an order and you know it's going to take a while to get a code status order. If they're saying to you that they would want to decline CPR, we actually have a CPR declination form, and that will be in the packets. Now, even though that's not a physician's order, it is at least signed by the tenant or their responsible party, and then, you know, put in the record until we can get the actual order signed from the physician. If they don't have an advance directive and want to schedule a facilitator session, we would offer that as well. And then whatever they have would be placed in that folder on the back of the door in their apartment, the holder for the document. In IL, the ACP client letter is something that is going to be with these documents that Penny's referred to. Oops, I was still, oh, you're good. The general guide will also be in there, the short form, the actual post, and then we'll have the facilitator contact card. And again, it would go on the back of the apartment door. And then I believe it's twice a year, we would like communities to do an ACP 101 seminar for housing within their settings in your community. You can go to the next slide, Penny. I think that's the same document. So just know, like Penny said, the actual packets aren't going to be rolled out as quickly as we had hoped. So these particular ACP documents that I'm referring to, and it's that kind of top box on the right there, those documents will be getting emailed to this group, everybody on the call, as an attachment today. Hopefully later today, Nancy's getting them put together. So please begin using those ACP documents with every client move in until we get your streamlined packets out, and they will be in that packet. Does anybody have any questions about that? I don't know, are they all muted? Oh, sorry, is the advanced directive post only for home care clients? You can certainly offer it to everybody, Jane. We would want everybody to have an advanced directive placed on the back of their door. Remember, if they're not receiving any services, we really can't intervene. All we can really do is call 911. And if they don't have a signed document, they would just be considered full code by paramedics, emergency services if they arrive. So even if they're independent living or assisted living without services, we would still highly recommend that they have a directive in place that's placed on the back side of their door. Does that answer your question, Jane?
It does, thank you. We actually have a place in the cupboards that we put ours, but we were going to do file of life also.
Okay.
Just for those
Rather
independent
than
Not we're not doing them. We're giving them to complete because we keep getting asked by emergency personnel for their med list and stuff. Of course, we don't have that, so it's just an option for the tenant to use those.
Okay. And I think, Dr. B would say, for consistency, so that it's what they're used to, if they could do it like this and put it on the back of their door, and I guess even if it was the vial of life, that would probably be helpful, Jane. We can look at the process.
Okay. Thank you.
I think that's a good point. It came up from someone else as well, where they were saying cupboards and do we have to put it on the door? I think typically even an IL, if somebody is urgent, the expectation is that they would pull the call light and that our staff know that things are in the cupboard. But really, if there's a guest there who doesn't really know that process and someone suddenly, is having a heart attack or whatever, they're likely to call 911. And so and I know when my parents lived in independent living and they needed help, I called 911 because I knew calling the staff would just delay getting 911. So I think it's really important that it be on the door so that anybody, even if they don't know where to look, can see the documents as they're moving forward. So that was.
I think it's kind of a standard. Yeah, I think it's kind of a standard in the field that it's located on the back of the door. And I know that people worry about HIPAA, but you could, even the individual themselves, if they have a lot of company, but you could even put a cover page on it that says advanced directive or post or something, so that the information is just not like right there and visible.
And then again, all the forms are there and ready for you that Jenna's got. Now, I did get a message from Shelley wondering if she can you unmute? Do you want to be the presenter, it says? If you have something to share, I can certainly make you the presenter.
Penny?
Yep.
Hi, John Franzfog. Taylor's out of town today, so you've got a real poor substitute for her. I have a question for you and Jana. Relative to the comment about people for whom we're not providing services and that you would just call 911 rather than initiating CPR, if I understood that correctly. What about the fact that Dr. B is wanting us to all have AEDs in our buildings? Does that change the complexion of that statement?
Oh, I wish Dr. B could answer that. Anybody else out there? Any nurses on the call? Can you answer?
I know the reason that we're asking people to put AEDs in the building is really it is for our staff, but not necessarily for our staff. Where he is saying is that, and I don't remember the exact statistics, but basically CPR does not work in any level of consistency to really be able to save lives. So he's basically saying, no matter who is initiating CPR, we want to maximize the opportunity to save that life. And I think when we talk about if somebody's in independent living, and I think that's a really good question, John, that I'm going to ask Dr. B to answer. Basically, what we've been saying is if somebody pulls their emergency response, we don't have access to their medical records. And so they're like a human being on the street, literally on the street, right? So if you see someone having a heart attack, or if you see somebody in need on the street and you don't know anything about their medical history or whether they're having a seizure or what's going on with them, you're not going to help them. You're going to call 911, right? But if you see someone on the street who's clearly not breathing and you are CPR certified, you're going to apply CPR. So my guess is that, Dr. B, is that the talk about calling 911 is really in the, I know nothing about you, and even though I'm a nurse, I can't assess you without access to your medical records. So nurse, you need to call 911. I think that may be a different answer when it's talking about somebody who obviously needs CPR and you are CPR trained, but I will take that back to him and get some clarification.
Yeah, it's important that that distinction be clearly spelled out as succinctly and as firmly as just, if we're going to make a statement that we don't provide services with CPR, then we need to fold AED into as a succinct a decision.
Yeah, I had never heard that we would not do CPR, but I think emergency response calling 911 often is CPR. So that point of clarification is really important, and I'll get back to the whole group on that.
Yeah, so don't go by what I said, please. Let's hear it from Dr. B. Thanks, Penny. Thanks, John.
Okay, any other thoughts or questions on that? So Shelley Solberg, are you on the line? Okay, all right. Well, Shelley, if you need to speak up here. And of course, my computer froze up again, which means I need to. All right. Okay, so the next thing to go over is regarding supplies. You know, and again, there's been some conversations around this. I sent out an email the other day, but just want to clarify. So there are two reasons to look at supplies here, and both of them kind of relate to the same thing of either keeping our costs down or allowing families to have convenience tools that will assure that we do not run out of supplies. So two areas of supplies that people have talked to me about are one, diabetes strips and diabetes meters, and another one if we're doing the INRs. I think Amy from St. Peter's, she brought up regarding the INRs. And so I'm going to start with the diabetes and then we'll go into that. So within the diabetes, the reason that pharmacies do not deliver the strips is because if you're going to, and then bill Medicare, is because if you're going to bill Medicare and have them delivered, you have to be certified by Medicare. And all the individual pharmacies are not certified. So it becomes where the family has to go to the pharmacy and make whatever arrangements they made to pay that on their own. But if you are certified by the federal government, where two folks are, you can then be a part of a program where these people will check in with you. Your product should be running out now. Is it running out? Okay, we'll ship you some new stuff. So they not only are an access to it, but they actually monitor the supply and make sure that you never run out. And then they bill Medicare directly. So this will mean that some of you who have said, I'm just going to supply the strips because they're always running out, don't have to do that. It's covered. And then even if you don't supply the strips, it's really a nice convenience thing for the family. So there is a webinar scheduled for June 28th, next Thursday at 10:30 a.m. And a representative from ArcRay is going to talk about not only their product, but the other, because obviously people have choice. So what are the other ways that you can have this, the strips delivered automatically? Within the ArcRay, they're also going to offer some other tools and resources that they have, because I know if you have a diabetic on your home care and your assisted living, you're doing more than just taking the insulin. You're helping them understand, their disease. You're helping the family. You're doing all sorts of things. So they've got lots of tools around that are kind of becoming the industry standard tools because they're a very big provider of diabetes supplies. So they're going to offer you two things. Here's the education and the training so the family can get these supplies, and then here's tools for your nursing staff to use in education that you can choose to use or not. You will all be receiving between now and Thursday a diabetic glucose monitor, the meter, and so that as they talk about the program, you can see the meter that they're talking about. It's a meter that actually talks to you and tells you what to do, makes it super simple. It's very cool, it's free for everybody. So just look for that, and then also they'll have included in that the education materials that are available to you. So take a look at that. Please, if your director of nursing is not already aware of it, let he or she know that is coming up, because I think that's going to be a really useful thing. Any questions on that? Okay. INR. So very similar. This is also going to be coming up, being scheduled. Oh, one more thing about the diabetes. It's not on your invite calendar yet because Nancy's waiting. We have to get
Penny?
From Sarah.
Penny?
Yep.
There's a ton, this is Jana, there's a ton of feedback.
Is this better?
No, it's like you're in a washing machine.
Really?
Yeah, still,
Oh.
like, really bad.
Let me try one other thing. How about now?
Yep, great, perfect, thank you.
Okay. All right. So Nancy has to get something from Sarah Grew in order to make that call happen. So that invite should be going out yet today. So the next one would be the INR. So the INR, it's very similar in that if a building is doing an INR, they're assuming that they need to have the meter and that the person would get the strips, but often the building is just saying, I'll do the INR for the same reasons. There is, and because most people think that INRs are not, or the equipment is not covered for persons who are in assisted living, and that is actually not the case. If you meet the criteria for Medicare coverage by being needing your like if you've been on warfarin for more than 30 days, you would meet it, but then there's supposed to be all this other criteria about the ability to give it yourself. And then the thought is, well, if you're in assisted living, you can't give it yourself, but or can arrange to have someone give it to you in your home. So most of our people, if not all, should meet this criteria. It's the same exact thing. The meters are free. The strips are delivered directly, and everybody can then have their own. And then you don't need to worry about, in between people, all the infection control and everything else either. Everything can just be kept in that person's apartment. So again, should be a positive all the way around. And allow people to be able to allow you to do the INR and charge for the INR as long as you're comfortable for it, and they don't have to go out to the clinic to get that read. So that will be scheduled as well. Keep an eye out for that. Any questions on that? Okay. So the next thing I wanted to go over were some tools. Need to open. That I just think are really helpful things to have. And so again, some of my technology is struggling with me here, but I'm going to try to bring some of this up for you and also to show you where it is in eSource. Oh, that's the advanced directive. So one tool, this over here, and that's the wrong one. Some of you may already be aware of this, but I know I went through this with my own family in that my mother-in-law was eligible for veterans benefits, but completing the paperwork and then getting her approved was basically a nightmare, and had to be done ultimately because she's my mother-in-law by one of her children, and we ultimately didn't even get it done because it was just too complicated. Where this organization called Patriot Angels, it is 100% free. This information is on website, and if anybody, when they come in, you can ask them if they've been a veteran, and if they are, you can connect them to these Patriot Angels who will interview them and determine if they are entitled to veterans benefits that will help pay for the care that they provide, that they receive within your facility or within your home. And they will do all of the work for them for free. They have lawyers, they have everything. It's just a very cool resource. So want to make sure you're aware of that. Any questions on that? Okay. Another one is, of course, it's not responding. Another one is Q-Link, and I don't know if you can see my page in the fact that it says the website is not responding. Okay, let's try this again. Oh, there we go. Another one is Q-Link, and this is for anybody who's on Medicaid. And so this will, as long as you meet the financial criteria, they will give you a free smartphone and a free monthly plan, so any of the people in your buildings that are on Medicaid can have that. Another one and there's several of these out there. These are for people with hearing loss that need a phone that they can read, and or relay or any sort of TTY or what have you. And again, the phone is free, the services are free, the setup is free. You just need to call these folks and they'll get them set up. So you can use these for yourselves or for the families or whatever you want to do. And they are all available on eSource. And so I will show you where they are at on eSource. Or not. So you would just go into departments, go into housing, housing documents, and then helpful tools and resources. So all of these sorts of things as we go through will be placed here. Another one in here, and we can go over this in another meeting, is Help Mom Move. So they have people all over the country where if somebody says, you know, I don't know how to downsize my house or sell my house, and you want someone who will help you through that, these are organizations that you can refer them to in that. So any questions on the tools? All right. So the other thing to share with you is we've got some new reporting now that we've got a new CEO and a new COO. As you have heard for a long, long time, our future is housing. And so one of the first things that they said was, well, you know, all of our metrics, all of our reporting, all of our everything is really based around the SNF. So how can we start moving that forward? So they've got a couple of tools that they will be using to share with you. One of them is the operations summary. So every month, the CEOs meet with their operational vice president, and they have gone over something similar to this top part here. Now there's a new section added on the bottom that the housing directors, managers, CEOs, however you are going to delegate this in your building, will need to figure out. So just to know that this information is going to be looked for. So it's last month's major accomplishments, current month's priorities, collections and doubtful accounts, net operating income to budget, and then if you're not meeting it, what is the action? What are you going to do about it? Significant financial variables, key metrics labor report, which I will show you as well. Any agency staff, any open positions, focus and execute, making sure that you're updated, that you've got an action plan in focus and execute, and that it's up to date, and that you're meeting the timelines and the measurements of the action plan. Progress in the dashboard, and I know we went over the dashboard pretty quickly today, but If anybody doesn't know how to find that, let me know and I could show you where that is on eSource. But you can drill that down into your individual facility. So making sure that all of that is up to date. Seeing where you're at on your safety index. And safety index for housing, assisted living falls with major injuries and percentage of med error. So again, I believe everybody's already doing that within your directors of nursing to make sure they're reporting that for their housing as well. So that's the safety. And then survey compliance, where you at with any reports, any complaints, etc. And then any support center requests that you would have from us so that it makes sure that the OVP is aware of it and assuring that person such as myself are following through. Any questions on that? Okay. I want to... So one of the reports that they mentioned is opening. So I'll slide it over here, is this one. So this is a report that was put together by Steve Prisbella, and as you can, it's something that any CEO on the call or John can tell me if this has been out for the sniffs for a while, but you can see now it is ALIL key measure labor reports. So some of you may have been contacted about these numbers if they look weird, to make sure that Randall is pulling them correctly, etc. So just to go through, so each one of you will have this, it's individualized to the person, and the direct nursing hours, the direct RN, direct nursing premium. So the way that they're going to do this moving forward, and it's draft 2, is they're going to have this for the campus. So like Duluth would have a key labor metrics report that is specific to BLC Duluth. But then within that, then Shire would be able to break down into Marywood or Westwood or what have you and look at hers. So right now they're kind of separate, but I know that some things are shared, and so it does get a little kittywampus. So as you start to see this report, if anything looks unusual to you, please let us know so that we can make sure that it's accurate, because Steve and the finance folks and myself will be looking at this every month. And I think what's helpful in this, kind of back to that original conversation of we're not quite meeting the metrics that we should be within the industry and within BHS, being able to compare ourselves to our fellow colleagues is really helpful. I know, and I do that often, is look for what are the comparables. Is there another building that's kind of the same size? Well, how are they able to do it this way? And maybe some of that expertise can be brought over here. So I think it's a nice way when it lays out this way that everybody can kind of see. So again, it talks about pool, average wage. I know that's a huge issue for many of you, are my wages to my market. And so again, you can look at other metro markets, you can look at other rural markets and see where the wages need to fall in line. Non-productive time versus productive time. Total cost per resident day. And all of this is coming off of SmartLinks. So the other thing that's going to be coming up is a webinar regarding SmartLinks and just how you can, to make sure that all of our assisted livings are using SmartLinks in the same way, are aware of all the tools that SmartLinks can be available to you. Everybody, with the exception of Villa St. Benedict, should have access to it, and it's got some really nice bells and whistles. That webinar, unless you're already feeling like you know what the resources are and how to best use SmartLinks, I would recommend going to that webinar as you see that invite coming out. And I think that's next week as well. Any questions on that? Okay. So then just some general updates. I don't know if you saw them yesterday, but I can just show you quickly some renderings of Northfield for anybody who wasn't on that call. Northfield, I literally 2 seconds before this call got a call from the architect saying the drawings are now final and they're ready to go. So the shovel should be in the ground ideally. Andy's working on some final things starting right now. Starting like this week or even next week. So this is Northfield in the renderings. It's going to be 24-bed memory care. It's going to be 24-bed assisted living and 40-bed IL. And it will be independent and obviously in Northfield. I'll look at the other one here. The other one will be a part of the St. Gert's campus. It's 2 miles down the road. But it will be under Rick's very qualified hands. And it's going to be quite a bit larger. It's still going to have the 24-bed, going to have 40 assisted living, and then I believe the total is 198, so whatever the difference will be in the IL. And so this one, I'll just show you one other drawing so you can kind of see the renderings of it. And so this is what this building will look like when it's all done, with the IL being on the left, the 4-story, and the rest of it on the right with lots of open windows. And there's a brand new architect, the Cunningham Group, that BHS has not worked with before, and they've got some really cool ideas. So as part of that and getting ready for these buildings and getting ready for Matrix, the last thing that I have on my agenda is just to let you know what we're doing as far as getting ready for that and what are some of the principles and practices that are standardized across all of our settings as these new buildings go up, that we're putting these in. So we're updating the Minnesota Comprehensive Home Care Manual. And as we're doing that, we're really asking ourselves what really has to be a policy and what is really kind of best in practice. So for example, in the policy book, and this will relate to the other states as I finish the sentence here. For example, there's a policy on hand washing. There's a policy on combing hair. There's a policy on this. You know, would it make more sense to say that it is the BHS standard that all of our staff will be trained and tested in competency in providing ADLs? And then, you know, each one of you, and then give you the competency checklist so that instead of having to meet the perfect language for the Minnesota law versus the North Dakota, we know that it is our BHS standard that everybody be tested and to assure that they can provide the basic cares and service and the basic ADLs. So we're kind of looking at that and how can we do this so that, you know, everybody, no matter what state you are, can have the basic, here's the BHS standards and ways, and then we can adapt your reality to your state. Because I know outside of Minnesota and getting some of those tools, you guys have been a little bit more on your own out there. So all of that is being done. Linda has done a ton of work on that. Nancy's been helping her with that. Jerry, the clinical service team, myself. So start looking for some of that as some of these new tools are rolled out as well. And with that, that's all I had for today. Does anybody have any questions? Is there anything that anybody would like to share that's going on, really positive things, something you need help with? Any other updates? Okay. Quiet group. Well, with that, I will give you the gift of time. I think we're 9 minutes early here. I'm sorry for the technical difficulties. Appreciate you bearing with me on that. And if you have any questions, comments, or concerns, let me know. Otherwise, some of this information, as I said, all of the advanced care directive information will be sent out by Nancy, ideally later for today. And as these things come out, if you have any questions, contact Jenna or myself. And if I do not see you or talk to you, have a wonderful weekend and a wonderful holiday.
Thank you.
Thanks, Penny.